I would like to welcome all students who attend this session. Welcome to Flinders University and this information session, which is about postgraduate public health teaching program. So during this session, I briefly introduce 3 degrees within postgraduate public health teaching programs. And of course, you will have lots of questions after that, and I can answer some questions today. And then if you have more questions or need more information at the end of this presentation, I will provide my contact details as well as some other contact details that you may need if you need more information regarding, for example, enrollment process or anything about these teaching programs. My name is Hossein Afzali. I'm an associate professor in health economics. I'm also a coordinator for all postgraduate public health teaching programs, which includes Master of Public Health, Graduate Certificate in Public Health, and Graduate Certificate in Health Promotion. So before I start, I wish to acknowledge and pay respect to the traditional custodians of the land upon which we meet. I would also like to acknowledge and pay respect to the elders of the land, both past and present. So before my slides, I would like to share a video. It's a short video, about 2 minutes, which provides some general information about Flinders University. Thank you.
Hi, I'd like to take this opportunity to welcome you to Flinders University. Every year it's terrific to see new faces on campus and to know that so many people have chosen to study here at Flinders. I love walking through the hub, feeling that incredible buzz and seeing students just like you, talking to new friends, sharing ideas, helping each other out. These are just some of the things that make Flinders such a wonderful place to study, as I'm sure you'll discover once you find your feet. Your first few days may seem a bit of a blur. We've all been there. Starting university is a big step, and it takes time to learn all the ins and outs. But don't worry, plenty of support's available to help make your transition to life at Flinders as easy as possible. Flinders staff and student ambassadors can help you find your way. And I know from experience that your fellow students are kind, inclusive, and always ready to help. So where do you begin? Well, Flinders' website's a great starting point. You'll find campus maps and plenty of information about university life. Our Ask Flinders Facebook page will keep you up to date on university events and Flinders news. Flinders also has a busy social scene, and Flinders University Student Association, FUSA, can help you find social clubs and many other activities. As well as online support, we also provide support in person at our campus locations at Sturt, Tonsley, Victoria Square, regional South Australia, and across the Northern Territory. Here at Bedford Park, the Flinders Connect team in the hub can answer questions about enrolments and course information. The Student Learning Centre within Flinders Library is also a great resource for any academic help that you might need. Our confidential and professional health, counselling and disability services are available to all students. And Flinders Oasis drop-in centre is a warm and inviting space for people from all backgrounds to socialise. Oh, and of course, Bedford Park has plenty of food outlets, although I'm sure you've discovered those for yourself already. I'm confident that you're going to love being a student here at Flinders University, and I hope you're going to have the time of your life.
All right. I believe now you can see my slides again, and if I change my slide, still you can follow my presentation. If not, please let us know. So let me talk a little bit about our organizational structure. Why? Because as a postgrad public health student, Now you are a member of an academic discipline. So probably is better to know how this, what is the place of public health within Flinders University. It will be around a couple of slides, and then I will focus more on public health teaching programs, especially MPH. So at Flinders, we have 6 colleges. Currently, we have 6 colleges, including College of Business, Education, Humanities, Nursing, Science, and College of Medicine and Public Health. And Public Health is placed within College of Medicine and Public Health as one of those 6 colleges. Within College of Medicine and Public Health, there is a range of teaching programs offered by this college and different disciplines and different groups. And these are some key examples of teaching programs within College of Medicine and Public Health, including medicine, CBT, biotech, paramedic science, and again, public health, which is a part of College of Medicine and Public Health. So these are some core public health stuff, and you will see these people over the next, if you enrolled in MPH over the next 1.5 year or 2 years, or if you enroll in graduate certificate degrees over the next 6 months to 1 year. So the key point here is that we have a range of expertise, including biostat, epidemiology, qualitative research methods, health promotion, chronic condition management, health economics, and First Nations health and well-being, social determinant of health. So as you can see, and leadership, public health leadership. So a range of expertise, and all these staff are willing to share their expertise and experience to help you learn. And they are very, very supportive, I can assure you. And if you have any questions about your topic or any other issues, these people would be the first point of contact when you start your topic. And definitely they can provide lots of support and more information and direct you to a appropriate support service, whatever you need in terms of, technical, or if you need academic support, further academic support, or if you need, for example, health and well-being support. Again, these people should be the first point of your contact when you start your topics and study. Uh, in order, and I think I mentioned here, in addition to a study guide, so when you enroll in any topic, there will be a study guide, usually or most often, a study guide or topic guide, in which you can find all the information about this stuff, including their contact details. Also, I provided this link. If you click this link, again, you can find the contacts of all these people as well, in case that you need to contact with. A little bit about public health at Flinders and the public health teaching programs. So I provide you with a big picture, and then we can discuss more details about the teaching programs and its key features. Public health at Flinders, it's about improving your knowledge, and especially, and I highlight, practical skills for practice of public health. I think these practical skills is something that we really care, and our topics are designed in order to improve your practical skills as well. So that's why we have lots of practical sessions, and or tutorials, group discussion, or workshops or seminars, depending on the nature of the content and topic. We have a range of non-lecture sessions. And as I said, the aim is to improve your practical skills, as We think that's a really important aspect of learning, especially in terms of public health. The general aim or the broad aim of our public health teaching program is to improve population health. So the way that we teach, or that this teaching program is designed, is to teach you how we can maximize population health. But at the same time, within this teaching program, we also look at equity, because there are sometimes there is a trade-off between maximization of population health and increasing equity. So I think this trade-off is one of the key aspect or key focus of our teaching programs. And we have different topics focusing on different things. For example, when you enroll in social determinants of health, then you will be exposed to lots of equity issues and how these equity issues are important in terms of within the public health context. But when, for example, in my topic, when I talk about economic evaluation, there are lots of issues around how to maximize population health. And I think these different views in terms of the impact and significance of equity, as well as the significance of population, maximization of population health, gives you a big picture of public health. And especially our core topics are selected in order to cover both key areas in public health. So that's a big picture of our teaching program within public health at Flinders. In order to get more information about MPH graduate certificate and in public health and graduate certificate in health promotion, you can quickly look at this or visit this link and website, and then there are some definitely there is more information about the structure of these programs, then the number of core topics, the type of core topics, the type of option topics, the type of capstone topic. So there are lots of information and learning objectives that you can find in this website. So when you click this link, all three postgraduate public health teaching programs, there are information about all these three degrees. And I think I said as at 18th of July, which is yesterday, we have 294 students enrolled across three degrees: MPH, graduate certificate in public health, and graduate certificate in health promotion. And this year, I mean 2022, we had 172 new students with a diverse range of backgrounds. So I think it gives you a really or excellent opportunity to interact with different students coming from different countries or different backgrounds. So we have this year we have around 40 students, 50 international students coming from different countries. And I think the University Hub is an excellent place to interact with other students and learn from each other. As I believe, as a program coordinator, you can learn lots of things from each other. And this is really important. This sort of improving communication skills is another aim of the teaching program. It's not just about biostudies, although it is important. It's not just about epidemiology. It's not just about, for example, social determinant of health. It's also about how to improve communication skills, and this is part of one of the aim of this teaching program as well. And you can see within our topics we have several assignment or assessment activities which assess your communication skills, or how to draft a report, or how to draft a kind of essay, and this sort of thing, all related to communication skills. I think there is only one slide here that because this is about our teaching philosophy. I think every single university or every single teaching program should follow a very specific teaching philosophy. And at Flinders, Public Health at Flinders, we follow a student-centered learning or approach. And what do I mean by that? It's active engaging group discussion. We think students should be a part of this journey or learning process. So that's why probably you will see over the next few months that all your topic coordinators encourage you to actively engage in discussion boards, and some topics actually consider or assign some marks for your active participation. And again, this is really, really important because it improves your communication skills and teamwork skills. And some of the assignment or assessment activities are kind of maybe is a kind of, I think from my memory, kind of group presentation as well, again to encourage students or to improve their teamwork skills. So again, as I said before, that's very important aspect of learning within public health at Flinders University. So definitely we will have lectures, but as I said, complemented by practical sessions or tutorials or workshops or seminars. Again, this sort of engagement, active engagement, your active engagement in group discussions, discussion board is a key part of the learning process. So please make sure, and I understand some of you might be busy with other things, especially at the postgrad level, we expect this, but please make sure that you can effectively manage your time in order to participate in this sort of practical session and tutorials. Tutorials and practical sessions are, as I said, are a really important component of the learning process. So please, as I said, manage your time in order to attend these practical sessions. And some of the topics, as you can see over the next few months, they may, or topic coordinators may record their lecture. That's fine. It would be easy for you to just to watch the recorded lecture. But we highly encourage students to attend tutorials and workshops. Or if you can't, then definitely watch the recorded tutorials and then ask questions from your topic coordinators. As I said, online delivery is part of our topic delivery. So because we deliver both, I mean, in terms of mode of delivery, all topics can be delivered online uh, or face to face. So sometimes there is a hybrid uh, mode of delivery, but yeah, online delivery definitely is an option. But again, I encourage, even you enroll in online mode, we encourage you to attend all tutorials and focus group discussions. Um, I think, as I said, we have within public health teaching programs. I'm not sure how many of you who attended today actually enrolled in MPH or graduate certificate degrees, but I just briefly discuss all these three degrees. So we have you enrolled, probably enrolled in MPH 2 years or 1.5 years. Again, there is a uh, difference between these two MPH programs in terms of admission requirement. And then we have, and when you enroll in 2 years program, it is technically it's a 72 unit program, and if you enroll in 1.5 year program, it's 54 unit program. And then we have graduate certificate in public health, 18 units, and we expect you can finish in 6 months, although sometimes one of the core topics for graduate certificate in public health or graduate certificate in health promotion is not available in second semester. So if you start in second semester, probably you will finish in your degree in 1 year instead of 6 months. If you start in first semester, definitely you can finish in 6 months. And as I said, most topics within our teaching programs are 4.5 unit topics. We only have a couple of 9 unit or 18 units topic, and 18 units topic is just and 9 unit topics that they are just a capstone topic and one program evaluation topic this year, which is 9 unit topic. So mostly 4.5. Each topic has a study guide, as I mentioned before. You must look at the study guide. So when you have access to the the topic flow site, uh, that would be your first action. Just upload your study guide, because there are lots of information and critical information about the topic within your study guide, including timetable, assessment activities, due dates, um, and late submission penalty and everything. So please have a look. And if you have any question or if it's not clear before even before lectures, you can ask your topic coordinators or any teaching sessions, ask for more clarification. It's really important that you understand all the policies. Again, as a postgrad student, we expect that you should be familiar with all university policies, and there are lots of information, so you have to look at all this information, and if it is not clear, talk with your topic coordinators. And as I said, full-time students can normally complete 18 units. As a program coordinator, I really discourage you to take more than 18 units of a study, unless we have a reason or rationale um, about this. For any teaching programs, including MPH, we have some core topics. And again, within public health at Flinders University, our core topics, a range of core topics, actually cover or captures 4 big areas within, again, public health. First one is how to identify a health problem or public health problem, and the reason and rationale for this sort of problem. And we have a few topics which focus on this side of public health public health issues. And then if you identified the problem, how to develop a solution. So these are just some examples. For example, how to critically analyze existing policy and evidence to show that this policy or evidence not working, and that's why we have the problem. So this critical analysis is, again, a key part of many assessment activities especially within our core topics. The next one is principles of research methods. We have, as a core topic, we have a range of quantitative topics like biostat, and of course it's at an introductory level. We have lots of a few epi topics as a core topic, again introductory, and then we have a few option topics, which is a more advanced epi, and then we have quite a few qualitative topics, including qualitative research methods or survey design, for example. So these sort of core topics equip you in terms or improve your knowledge and skills in terms of how to generate new evidence in order to identify a solution for a public health problem. The third area is evaluation of healthcare interventions. So this is another important area because you need to know how to evaluate a healthcare program. And when I say evaluation, it can be a acceptability or effectiveness, or if you take economic evaluation, a kind of cost effectiveness evaluation. And finally, leadership in public health is one of the core topics within 72 unit MPH program. And as I said, the structure and the number of core topics are different for MPH 1.5 year and 2 years. And then we have a range of option topics. This year we have 15, 16 option topics, and from next year we will have around 20, 21 option topics. So it's a great range of option topics covering a big range of public health area. And here I just mentioned a few examples. For example, advanced topics in biostat, advanced topics in epidemiology for those who are interested. We have uh, a couple of topics in public health, nutrition, aged care, chronic conditions, environmental health, health ethics, digital health, which is a new option topic this year. So as you can see, a great range of public health area that you can choose from in terms of option topics. And as I said, from next year, we will have 2021 option topics, a great uh, choice. Also, teamwork and communication skills. I think I mentioned this before. This figure shows how our three or four degrees communicate with each other. So if you start with graduate certificate, then you can enroll when you finish it. Excuse me, you can enroll in our MPH. So with all 18 units that you completed during graduate certificate, uh, counted or credited towards your MPH. Or if you enroll in MPH, then for any reason that you, for example, personal reason, if you want to exit, then if you meet the requirement for graduate diploma and 36 units, then you can be awarded an exit or graduate diploma in public health as an exit award. So there are a range of options. And again, if there is any question or any more information that you need, you can contact me, or I will provide more information about other people like enrollment officer or student advisor that you can contact with them. And this is just an example of MPH structure for 2 years. So as you can see, a number of core topics, and then we have a range of option topics. And I think that the most important or one of the strengths of our program is our flexibility in terms of offering uh, capstone topic. So you will have generally you will have two options. Broadly, you will have two options. Option one is coursework, which is practicum in public health. And again, there are two streams within this. I will talk about this, which is PACA 9509, and of course, towards the end of your program. So that's capstone topic. When you are going to finish your program, towards the end of your program, you need to complete your capstone topic. Or for those who are interested and are eligible, and again, I highlight they should be eligible in terms of GPA and their research interest, then there is another option, which is public health dissertation, which is a smaller scale research. Um, More information about capstone topic. So as I said, the PACA 9509 is 9-unit topic, and it's one of the capstone topics. But within this capstone topic, you will have two streams or two options. So first of all, the prerequisite, you have to finish 54 units of your topics before taking this capstone topic, or 36 units if you enrolled in 1.5 year MPH. Then you can choose from stream A, which is public health project, which is about critical evaluation of existing evidence or policy. There are a few lectures that you have to attend, and then is technically is very similar to other topics, but this is non-unit topic, so more time needed to do your activities or assessment activities. And a stream B, which is industry placement within PACA 9509. So you have to, first of all, you have to complete and submit expression of interest. Again, not now. This is when you finish your 54 units. So usually always, I will make an announcement and provide the expression of interest form, and then ask students, those who are interested in industry placement, to complete the expression of interest form. And then we will go through a process and interview, and subject to availability, because we have a few industry partners, subject to availability, you might be placed in one of those one of those organization, public health organization. And as I said, here in this slide, it might be related to a policy design, depending on their demand, program planning and evaluation, literature review, data analysis. So we will talk about this later on when you finish uh, uh, at least 54 units of your topics or 36 units in your study. PACA 9512, which is public health dissertation, which is the research pathway. So it's can be done in one semester as 18 units, which is again is it needs really good time management and time commitment, or it can be done in 2 semesters, so 9 units each. Again, we are providing different options depending on your situation. The prerequisite is the same, so you have to finish 54 units because this is a capstone topic, or 36 units in MPH 1.5 years. And then if you choose this, and again, there is a process to select, and again, I will send an announcement toward the end of each semester for next semester. Then it's kind of expression of interest form. You have to answer some questions. And if you are eligible, then there will be a few assessment activities. So you will be, so I specify or identify some supervisors and assign some supervisors. And then you need to develop a research proposal, undertake a project, and draft a manuscript. So this pathway actually is for those students who really want to continue their study or do PhD after MPH. So this small scale research within public health dissertation again provides some basic and important information about undertaking a research. So if you are not really interested in PhD or this sort of research, so probably that's not your option. So we have other options as well to complete your capstone, as well as and followed by completion of your degrees. So graduate certificates. So that was about MPH. So as I said, graduate certificates are intended as introductory course just for upskilling and increasing your employment opportunities. As I said, it's 18 units. And this is the structure of graduate certificate in public health. So we have one core topic that you must do, which is social determinant of health, and then plus 4.5 units from this list. And then there is a range of option topics that you have to choose at least 9 units. So in total, 18 units. That's the structure. Again, the link that I provided at the beginning of my presentation includes all this information with more information about each topic. Graduate certificate in health promotion. So we have two core topics, health promotion and social determinant of health. And 9 units, again, from a range of option topics from 15 to 16 option topics that are available now. Study plan, this is just an example of a study plan, and this is for full-time students, for example, enrolled in MPH 1.5 years. You can we can adjust this study plan, and many students actually make their study plan, and if they have some questions, they just ask me. But it's okay for students to contact me as a course coordinator, asking for a meeting at the beginning of each semester or at the beginning of their study to discuss their study plan. So that's completely fine by me. And I think that's important. You know that, and probably you know that not all topics are offered in both semesters. So you have to make sure that your study plan, given your time, it's working for you in terms of when you, because there are some core option topics, there's no problem. But in terms of core topics, you must finish your core topics. So that's why you need to make sure that in terms of semester availability, which core topics are available in which semester. In terms of capstone topic, there is no problem because capstone topics are offered in both semesters, semester 1 and semester 2. In terms of potential employers, when you finish it, so that's how you do it. Now, next step. When you finish it, um, there is a range of academic and non-academic organization like Department of Health in Australia, PHNO Primary Health Network, Cancer Council, research centers, Diabetes Australia. Recently, we had um, I think we had a couple of students, graduates, MPH graduates, who now I think they are working Diabetes Australia or Heart Foundation. So there is a good opportunity, especially over the past couple of years, good opportunity for public health graduates to work in this non-academic um, organization, public health organization. And as I said, in terms of jobs within this organization, they definitely need public health officer, program development and program evaluation, project manager. Again, the leadership skills that we teach might be useful. Health data or health information officer, health promotion officer, study coordinator, epidemiologist for those who probably are interested in epidemiology, doing both introduction and advanced epidemiology, health protection and safety manager, research officer, and as I said, future study for those who are interested after finishing MPH and possibly doing public health dissertation to continue their study as PhD. And that's a great opportunity for those who wants to continue their study. A couple of slides, um, important slide, important information in terms of academic integrity at Flinders University. As I said, taken very, very seriously. And we had some issues with some students, mainly, fortunately, mainly because of misunderstanding and lack of information. So please make sure that you understand the principles of academic integrity. And in when you start your topic, I'm quite sure almost all, not almost, I think all topic coordinators will talk about academic integrity. And they provide lots of information. And here is just one link that I provided. And there are lots of videos here and information to make sure that you understand what it means by breaching academic integrities, like work or ideas which are directly copied from someone else's work. And as I said, in many cases, based on my experience, it's just about misunderstanding or lack of information. A student really didn't know this is a breach. So I think that's really important for you because there are some consequences in terms of breaching academic integrity. And definitely, we don't want you to be involved in this process simply because of misunderstanding or lack of information. Again, that's your responsibility as a postgrad student to look for this information and ask any question. And we have academic integrity officers within the college, given the significance and importance of this issue. So you can contact them. I think these are something that you probably know about this, and you have been, or hopefully, you have been provided with all this information in terms of Compass, and there are lots of information you can log in, and then you will have access to lots of personalized information, like personal information, and I think as I mentioned before, there are lots of support services, and this one is one of the must do task that you have to order your ID card. Some of you probably did it. Uh, and again, this is really important. So as a postgrad student enrolled in any degree, you have to access to this postgrad public health course site. The reason is that that's the only way that I, as a program coordinator, I communicate with you. All right. So that's really important. So it includes lots of handbook and a study pathway. So please make sure that you have access. So go to your flow sites that you have access to, and make sure that you have access to this flow site. If you don't, sent an email to Ask Flinders, asking them to include your name within this flow site. As I said, there are lots of good information over there, including program handbook and some study pathway, examples of pathway, and more importantly, any important things that I need to communicate with you. It's through this flow site, even expression of interest forms, for example, for industry placement and public health research dissertation. And I won't talk about these issues because these are just, you have to look at those websites, critical enrollment dates, semester dates. These are some critical or important resources that you, as a new student, you have to just make sure that you have all this information. And more information about the student support and services, a wide range of support and services, including academic writing. So there are some help for with academic writing for those, or even referencing, because in some assessment activities, referencing is actually part of the grading and marking. So you have to make sure that you understand the referencing and using appropriate referencing style. And of course, your topic coordinator will help you. But for more support, there are some people with expertise in this specific area which can help you. And of course, library resources. I think there is no need to discuss this. It's quite clear. So if you have any, and I think that's really, really important to make sure that you understand this distinction. If you need any course advice, which is, when I say course advice, it's not about enrollment. It's not about I can't have access to flow, because I can't help. So it's about content, structure, or study plan, anything about the study and program. Then you can contact me. But if you have any question about credit transfer, leave requests, payment options, enrollment, and this sort of thing, please contact Ask Flinders. And finally, I think that's my last slide, is student rep. Again, we really think that the student rep and the way that a student rep can communicate with other students to raise their concern is really, really important. And that's why our course rep, student rep, is a member of the Board of Education at the college level, definitely impacting our decisions. So for 2022, Isabel is our student rep, uh, and this is her email. But definitely, when you have access to postgrad public health course flow site, Isabel will also provide her email address and more contact details, just in case if you have you need to communicate with the student rep as well. I think that's from me. Okay, any questions or any comment or any questions? I'm more than happy to. We have 6 minutes, but as I said, definitely you have all my contact details. You can contact me for any questions. But for now, based on what I presented, which is mainly about this, just a general idea about public health teaching program, postgrad teaching programs. Uh, do you have any questions or anything that we can discuss? The first question is about Jade. So is there any issue starting the dissertation in semester 2 of, say, 2022 for 9 units and doing the other nine units in semester 1, 2024? Some of us with mid-year intake. No, there is no issue starting your dissertation in semester 2. Yes. So if you are, yeah, I think you said that. So if you are enrolled in 1.5 year program, then and if you are doing this study full time, then by next semester, second semester of 2023, you should finish, or we expect that you finish 36 units of your study. So that means you will be, technically, you will be eligible for a public health dissertation, and then you can do your public health dissertation in 2 semesters. So there is no problem to do your public health dissertation. If there is no problem in terms of your visa, I don't know, you are domestic or international. Some international students may have some visa issues that they have to finish it. Otherwise, there is no problem. The next question is about the visa. So the next question is coming from a student and some issue. And I am fully aware of this problem because of the delay in visa issues. But again, that's not my I can't make any comment on this. So probably better to talk with international student office. They have more information about this visa process. But in terms of your study, there is no problem. You can start your study because, as I said, all topics are delivered online as well as face to face. So you can just start your study, and I'm quite sure that we make sure that our topic coordinators are fully aware of this cohort of students who enrolled, but still, because of the visa situation, they can't come to Australia, and they will provide lots of support. So you definitely start your study online, and then hopefully you get your visa as soon as possible. And again, I recommend you to contact international student office as well. Um, any other questions? Or I don't see any, Mason. I don't see any other questions. Do you see any other questions or anything that I'm missing now? Okay. Okay. Yep. Thanks. All right. So as there is no other questions, so probably again, as I said, if you have any question, don't worry about this. You have my contact details, and also you can ask, even if you are not in Australia, we can, and I did this before many times, so we can set up a online meeting, and then we can discuss your study plan or any concerns regarding the content or a study, your study or your degree. uh, and if you have any enrollment questions, then definitely ask Flinders is the first point of your contact, or anything about visa, definitely international student office. So it was really good to not meet you, but talk with you virtually, uh, and talking about postgrad public health teaching programs. And I really wish that you will have a really good study experience, learning experience, and that's definitely is our aim. Thank you very much again. Thanks.